Hello and welcome back to the EMDR Doctor podcast. I'm Dr. Caroline Lloyd, and this last few weeks I have been busy researching and reading about shame for my upcoming webinar, which is happening on the 4th of June, which might be exactly 2 weeks away now. If you would like to join me for the webinar, please hop on my website emdrdoctor.com.au and go to the For Therapists menu, and you can book in via my website. So I have been down some fascinating rabbit holes researching about shame. In fact, today I was researching about BDSM and the link to shame and the history of sexual assault, but this is not what I'm talking about today. So that particular piece of the puzzle may or may not make it into the webinar. I haven't quite decided yet. But one powerful tool that EMDR therapists have, aside from just EMDR, which is an awesome treatment for shame, by the way, if we take EMDR one step further, then the blind to therapist protocol is what we need. Sometimes shame is just too big, too awful, too excruciating and uncomfortable to use talk therapy upon. Shame can be unspeakable. Sometimes clients just cannot describe in words what they've been through, maybe what they have done, maybe what they have witnessed or known about. And in this circumstance, the blind therapist protocol is absolutely ideal. We don't need to spend weeks or months or sometimes even years, as some therapies do, just to get to the stage where the client can give a verbal narrative of the event or the circumstance. We can hop into effective treatment and get the client some relief from that awful mire of shame. So what is the blind therapist protocol? Basic EMDR protocol, just without the therapist knowing what the client is working on. Sounds simple, right? So we set it up with asking the client to hold the picture of the event in their mind. They might give us some sort of cue word like the shed or 27. And we do ask them to identify the negative belief about themselves. Sometimes they won't be able to share that with us, but sometimes that just gives them the impetus to start thinking about that. We may be able to help them with this. It might be something along the lines of, I'm bad, I'm shameful, I'm disgusting, I'm not worth helping, I don't deserve to be here, I don't deserve to be alive. Now, I probably should add in a little bit here about that last negative belief. As a therapist, we do have a responsibility to assess for suicidal risk, and this is important here. But please don't let awareness of this get in the way of doing the effective therapy. Of course, you will know your client well, and please don't take my words as being individual supervision or consultation, as I don't know your client. But please be aware that this negative belief or negative cognition may not be about suicidality. It may be about the pain of shame. So we set up the blind therapist protocol with the picture, the negative cognition, which we may know about, the positive cognition, which, if we can find one, may be quite helpful, might not be able to find one in this case. We might suggest something like the positive cognition might be, I'm okay, I'm human, I can cope, I can live with this, I did my best. Sometimes these things are just impossible to believe before we start processing, but they may well arise spontaneously as we process. So we have the picture, the negative cognition maybe, the positive cognition maybe, the emotion, which may well be shame, the body sensation, and the unit of distress, which is the rating that we use as to how bad that particular memory feels. All of those are explicit, just the picture or the event is unknown to the therapist. And then we process. With the feedback, we can ask, is that memory changing? Is the picture changing? Is something new coming up? Or we can just check in with the level of distress. So that way we can keep somewhat of an eye of what is happening for the client without knowing exactly what they are working on. So this has been a little bit of a technical podcast with a lot of detail for the EMDR clinicians who are listening, but I do think that this can be helpful if you are a client listening to this podcast. If you are really concerned about processing a memory that holds a lot of shame or holds something that you don't want to share with your therapist, if you don't want to disclose to your therapist, you may not have to. If you want to try the blind therapist protocol, you can always ask your EMDR clinician to have a listen to this podcast or reach out to me for supervision if they need that. So the upsides of the blind therapist protocol is that the therapist doesn't hear about the traumatic incident. The client is not obliged to reveal the traumatic incident. And this can be helpful in lots of different scenarios. We can use it for people who have confidentiality constraints, like therapists, like doctors, like police officers or lawyers, people in the armed forces, maybe people in politics. So confidentiality can be a really difficult thing to navigate, and it prevents a lot of people from getting adequate care for really difficult memories. So this is ideal for them. So it's also really helpful in avoidance of vicarious trauma. So sometimes the client doesn't want to disclose what happened to them or what they witnessed because they're thoughtful about not hurting the therapist. Sometimes the therapist is thoughtful about not hearing those kind of awful experiences. Some clients won't tell you details about traumatic events to prevent you, the therapist, from being contaminated by their experiences. So we don't need to go into the detail. We can process without the detail. And that can be really reassuring for clients, really reassuring for therapists as well. Sometimes cultural issues are a really important piece of the puzzle. So the client may not want to reveal something about this themselves because they don't want to possibly amplify the distress of maybe the therapist and the client belong to a particular cultural group, a country that's been at war, and the client doesn't want to further distress the therapist. So that's one possibility. Or they may have slightly different political views from the therapist, and they may know this, and they may not want to exacerbate that difference between the client and the therapist if they belong to the same cultural group. So there might be communication barriers, like, for example, stammering or word-finding issues, or even complete aphasia that can happen sometimes following a stroke or a head injury. Or there may be an issue such as autism or ADHD, exhaustion or burnout, where that client has trouble finding the words, has trouble putting into a sentence or into words their experience. So this shortcut can be really helpful. The therapist can ask, is something changing? The client can just nod, or there might be a yes or maybe a no. And then that can provide enough feedback for the therapist to kind of keep going with that. There's another issue here that is commonly found with refugees. So perhaps people who don't speak the language of the therapist have a translator in the room with them when they're having therapy. Now, this can pose a lot of difficulties. So sometimes there is an issue with confidentiality or vicarious trauma, and the client may not want to disclose anything to the translator. So using the blind therapist protocol can avoid information being accidentally leaked or accidentally shared, and it can prevent further vicarious trauma to the translator. So the translator can be present in the room just for the setup of the memory, and using the blind therapist protocol, the client does not need to detail the memory. The translator can help the therapist instruct the client or teach the client about what change is, and then the client and therapist can get by just with body language, like a nod or a raised eyebrow and a nod or a shake, and keep going. And so long as this is set up with care, then that can be a really great way to work. So all of these examples are just some examples of the way that the blind therapist protocol can be used in one-on-one therapy. And of course, with my work with group therapy, with group EMDR, the blind therapist protocol is part of that group process. So me, as the group leader, as a therapist, I do not know what my clients are working on. They are usually at home in front of their computer. They have a piece of paper. They write down the name of the memory that they're working on. They may do a little bit of a drawing or representation. They don't share that with me at all. The only thing they share is the number of the distress level. So they share in the group chat about the distress. Yes, it's coming down, and I'll know where they're at with that memory as they process through it, just according to their distress level, which is a really great way to work in a group. And in that way, that using the blind therapist protocol and the blind to group protocol, nobody gets traumatized by anyone else's memory. There is no trauma dumping. There is no trauma sharing. I don't hear about what they're working on, but I get to know and enjoy that drop in the distress with the memory. And then sometimes at the end we share our positive cognitions, but that doesn't have to happen. That's always a voluntary thing. So these are all great things about the blind therapist protocol. The downside of the blind therapist protocol is that the therapist can't assist the client so much if they get stuck on something. And it's harder to pick the adaptive information that the client needs if we don't know where they are. But essentially we can, and we do, trust the client that they have an adaptive network, they have some adaptive information to help work through, and there are some really lovely interweaves, there are some lovely suggestions that the therapist can make to the client during the blind therapist protocol that can really help get those memories unstuck. If we get to a stage where there's no change, then we can use some of these very generic but very elegant interweaves or ways to assist the client if they're getting a bit stuck. So one thing that might stop therapists using the blind to therapist protocol is therapist discomfort. We like to be in a little bit of control. We like to know where our client is at for the best of reasons, because we want to help the client as much as possible. So one of the hurdles to using blind therapist protocol is the therapist's fear or hesitation or concern or worry that they won't be able to help their client enough. But I really want to reassure you, if you're a therapist and you have that concern, it's very likely that you are doing more good by even doing a partial session with your client using the blind therapist protocol, rather than letting the client just keep on just being mired in that awful memory. So we don't have to know everything about what the client is going through in order to help them in a really significant and profound way. And I would really encourage you to try it. If you haven't tried it yet, then I would really encourage you to try it. If you want to try it working with a friend or a volunteer first, that can be a really nice way to just dip a toe in and get to know the protocol a little bit more. So be brave is the take-home message to EMDR therapists who are thinking about using the blind therapist protocol. It's really helpful. So If you require a little bit more assistance in implementing this in your practice, feel free to reach out for consultation or supervision via my website, the emdrdoctor.com.au. And if you would like to learn more about shame, I am holding a webinar in a couple of weeks, as I mentioned at the beginning of the podcast. So this webinar, I hope, will be very helpful to people, to therapists who may have trouble identifying shame, may have a little bit of an aversion to it themselves, may be stuck in collusion with their client to avoid working on shameful issues, and thus may feel stuck in their work with their clients. So I would love to teach you some more about working with shame, help you with some practical suggestions, and help you understand the role and the function of shame in our inner life. So feel free to hop onto my website, emdrdoctor.com.au, and book in for the webinar happening in a couple of weeks on the 4th of June. And it will be available, if you're listening to this podcast sometime later, it will be available as an on-demand webinar. So I hope this has been interesting or helpful to you in some way. I will talk to you again next week. In the meantime, take good care. Bye for now.